I'm told. I think all of us have lost track of time. I had a patient this morning. I saw her yesterday, post-operative patient, so we're not violating any rules. And we were going to plan to meet at 12:30 today after this show. And she texts me first thing, and she says she has no clue what day it is and or what's going on. And I feel the same way. But anyway, we are getting ready to open on Friday or Saturday here. So finally we got the order from Governor DeWine. We did put a little video out, and just real quickly I just want to mention a few things. We have masks, we have social distancing, we've got plenty of things to clean your hands. You won't have to touch any doors, and everybody here will be wearing masks, most likely, at least for most parts of your stay with us. We have, through the month of May, a $9.99 promotion also for Botox. As many of you know, we're celebrating our 20th year anniversary. This is not the way we expected to start it, but we do have a promotion for Mother's Day through Memorial Day, and Hope and Karen will be treating everybody. So we're excited to get going. Today, I was actually a day off. I think 2 days ago I said that we were going to meet with Jerry yesterday. Anyway, Jerry Whitney, Karen Whitney's significant other, is joining us today to talk about some things that he has done with us. And we're also joined by Karen and Hope Mers and Karen Lynch. And Karen, what I'm going to do, Karen Lynch, I'm going to turn it over to you just to get started here, and maybe you can talk to Jerry about some of the things that he's done. Thanks.
Sure. So, Jerry has kept up with proper skin care and Botox and fillers throughout the years because he's married to Karen and he knows the importance of all those things. And as he was in the workforce and those were no longer working for him, he wanted to talk to Dr. Mendelsohn about rejuvenating his face and eyes and what that would mean to him. And so today we're just going to listen as Jerry, explains why he decided to do his facelift and his eyelids, and what his experience is with Advanced Cosmetic Surgery and Laser Center and Dr. Mendelsohn. So Jerry, I'm going to let you start talking.
Thank you. That's a big order to fill here, so I'll do my best. This goes back to 4 or 5 years ago. Karen and I were traveling with 3 of our daughters, and we were on a cruise actually, and I looked at myself in the mirror one morning and I thought, gosh, with traveling with all these beautiful women, I better push it up a notch or two here. And then Dr. Mendelsohn actually suggested to Karen that he'd like to speak to me about maybe being a businessman that would have a facelift and help him tell the story of why this is, I think, very important for us as businessmen to remain competitive, not only in our minds and in our actions, but in the way we look. And so I think only once before I've actually stated my age. So I'll be 70 in October. And
happy birthday.
Thank you. Well, you can give me a cake when that happens, John.
All right. Hopefully we won't be social distancing then.
I hope not. Well, I met with Dr. Mendelsohn and my wife Karen, and we talked about, how this would look, how long it would take to recover. Dr. Mendelsohn was tremendous, as was his whole staff, in making certain that I was very comfortable and understood everything that was going to take place. Plus, I, was very helpful to come home and speak with Karen about this in the weeks before and even the night before. So it was really what I would say was a very simple process. We did this right before Labor Day several years ago, and went in on I believe a Thursday morning, kind of reviewed everything with Dr. Mendelsohn and the team. And he gave me some really nice drugs, which, as he will tell you, makes me think I'm a comedian. And finally, he was like, "Can you keep your mouth shut? I need to finish this." But so go ahead, John.
Would you like us to show the joke that you told?
Is it a clean one?
No,
Karen, do you remember it?
I do.
Oh, I remember
Oh,
it.
yeah.
Yeah. Yeah.
It-
You don't have to tell it now, but anyway, okay, we'll
Yeah.
get to that.
Yeah. So it really was a very, I was very relaxed that morning and almost a little too relaxed. And the procedure, I think, Dr. Mendelsohn, what did it take? About an hour for the facelift? A little more?
Yeah, probably took a little over an hour, and yeah, it probably took a little bit longer. It probably took about an hour and a half. With us waiting for you to finish telling your jokes, it probably took a little bit longer that morning.
All right. Very good. And then I actually waited in, kind of not really, it's a recovery room, but a separate room while Karen was finishing her day and rode home with her. And it really, people ask me, was it painful? Did they put you all the way out? No, you're semi-awake. You can hear Dr. Mendelsohn speaking to his staff. Really felt no pain whatsoever. And it was very comfortable. And as I was saying, I was kind of cracking jokes, and finally Dr. Mendelsohn said, well, somebody give him something else so I can finish this. But came home that night, and probably I had a head wrap on around the bottom of my chin, and slept sitting up in the couch, in the corner of the couch. And next morning, did ride back in to work with Karen so that they could check my stitches, my sutures, and then I think I drove back home that day. But it really was pretty darn simple. And then one of the things that I liked was Dr. Mendelsohn, called me that evening of the procedure, texted me to make certain I was doing well, see if I had any questions. And then one of the things I did was every morning when I would get up, I would do a short video on my phone and send it to John and the team and kind of update them on my progress, how I was feeling, what I felt the results were. I did have some swelling, but not a tremendous amount, and some very minor bruising down along my jawline on each side. But the interesting fact was that on Saturday, I actually went to Kroger to do some shopping, to pick some things up. We were going to grill out at a neighbor's. And one of Karen's friends saw me in Kroger. I saw her out of the corner of my eye, and I saw her look at me. And she came around the corner the other way, and she said, Jerry. And I said, yeah. And she says, you look different. What did you do? And I smiled and I said, I had a facelift like 2 days ago. And she was quite amazed that I was out and up and about. And we went to our neighbors that evening, and the same sort of thing. People were like, gosh, you look a little bit different. And that's probably the thing that I enjoyed the most. Even when I flew to California a week or two later to go to the corporate office that I work at. And people would look at me and they say, you look a little different. The thing that I like that Dr. Mendelsohn does the best is makes you look so natural. You don't have that wind tunnel look, so that you look stretched. It was a very normal feel that I would get up in the morning and look at myself and say, yeah, that's the new and improved me, and it's a very comfortable look. And so that probably was the biggest question I got for the next couple of weeks was, you look really different to a very minor degree. You look very natural. What did you change in the last couple of weeks? And then I think 3 weeks later, we left and went to Cabo. No?
No, we went 10 days.
10 days afterwards.
We went on
okay.
vacation after 10 days.
Yes. And so we spent time on the beach, did some sailing, spent a lot of time by the pool. And it was very normal. The only thing I had to be careful of was taking a t-shirt off and pulling it up over my ears because there were sutures at the bottom of my ears. And to this day, people still look at me. When I share with them what I had done, the first procedure I had done, which was the facelift, they can't believe it. And so for any businessman out there who wants to, I think, especially this day and age where many of us could be laid off, or if you're an attorney and there's a lot of younger attorneys coming in and you want to look your best and look 10 years younger, I highly suggest that, this is something you should think about doing. And for those wives that are looking at their husband going, wow, could we take 10 years off of him? And, it really is worth it. And it's great fun.
So, I mean, you're such a nice guy, and Jerry is a great guy, and he's been a lot of fun. And so we started with the facelift, and then you mentioned just a minute ago that the first procedure. So tell me then, because at the time we did the face and we didn't do anything with the eyelids, and then we came back and we did something with the eyelids, and the reason why I'd like you to talk about that is I think that, patients have heard me say this forever, that, when we communicate, we look at each other's eyes and, you're tired, angry, sad, whatever it is. And so I think it's just one of the best things that anyone can have done. And if you wouldn't mind, maybe you can just share your experience with that. I know it's similar, but if you kind of take it away from the facelift and maybe just for a minute, I'd like to just hear your thoughts about that whole process, if you don't mind.
Yeah, once again, excuse me, I've got a little allergies here. Pollen count's pretty high out here in the woods. It was also very simple. Once again, I was awake to some degree, talking to Dr. Mendelsohn as he was doing it. And I'll take my glasses off for a second. I had...
you sit still. I'll bring the camera in because
okay.
I can see.
And so I had some of the... I guess the looseness in my upper eyelids removed. And especially, I was back out. I actually had a sales meeting the next day, or sales appointment the next day. And with my glasses on, there was no swelling. There was no bruising. And when I was wearing my glasses, people couldn't tell that anything had been done. But
Jerry, how do you feel about the I guess, well, maybe what you perceive, either before having this done or now, either yourself or from friends or other men, I guess, in terms of undergoing, cosmetic procedures? What's your approach to that? What are your thoughts?
I think everybody worries about, as I talk to people, most guys would worry about, gee, how long will I be down? Will I be able to go back to work in 3 or 4 days? Is it painful? Will I look like myself? Will it improve the way I will be viewed by my peers? Those are all some of the different questions that I have had people ask me. And I always just say, this was really kind of a fun adventure. That and for me, when I was in a meeting a couple of weeks ago, and I made a remark that my 70th birthday was coming up in October, and this guy looked at me and he said, "There's absolutely no way you can be 70 in October." And so that really is fun. It's very enjoyable, and it's always fun when Karen and I go out and get dressed up and have dinner, and it kind of adds a little extra bounce in my step. So it's enjoyable.
Well, I appreciate you sharing. Karen Lynch, maybe you can come back for a sec. And I'm just curious, Karen, I know I know we did a couple of little nips and tucks, with you. And I guess with regards to, I know we're talking about eyelids and the male facelift, and we're talking about some of the comparisons. But I think with you, Karen, as well, I don't know if you came in talking about your eyelids so much. Is that correct? As I recall, I think we sort of suggested it, and maybe I'd like some of your thoughts on what that did for you as well.
Yeah. So I wasn't really concerned about my eyelids. I hadn't really thought about them a whole lot, and I had seen all the people coming in and having their eyelids done, but I was just really worried about all the gelling and the sagging. And when it was suggested that, well, while we're doing that, we'll do your eyelids, I was like, okay. And So the more I thought about it, every time I was looking in the mirror, I could see the extra skin, and they were looking heavier, and it was harder to put on my makeup. But as soon as I had my eyelids done, I couldn't see my face because I was wrapped up that day after, or the day of. But that evening, I could look in the mirror, and my eyes they weren't swollen. They didn't hurt. It was so easy. It was the easiest thing I had. I mean, it was easier than a dental procedure by far. Even getting a cleaning, it was like there was nothing to it, and it was immediate. It was immediate, and there was color back in my eyes, and I could actually see the light reflecting from them. And I just love that I had my eyelids done. I love it. It's my favorite thing. I wasn't even planning on that being, something that I would be that excited about. I love it.
Yeah, well, good. Well, yeah, and I just thought I'd get that. I think a lot of people are focused sometimes on being tired, and sometimes, it's up to us to sort of just work with people to realize that some of that tiredness is really coming from this area. We've seen more and more people just with these Zoom meetings complaining of new things, but. Jerry, I just want to say for anybody viewing this, we have Jerry's true selfie story. We started these true selfie stories probably about 5-6 years ago, and Jerry was one of the first men that we actually followed through his facelift originally, and then his eyelids. They were two separate procedures, and he also came to our podcast, along with Karen. And so there's a lot of information out there on our website if you do want to follow some of Jerry's journey. Karen, what we have so far is her spinning around every day in a chair, but I don't think we've gotten anything together yet. But you can watch her progress day by day as she's spinning and healing. So I don't know. Do you guys have any comments? Anything else you'd like to share?
Yeah, what I would say for any man who's feeling insecure about his appearance, for Jerry, it was some sagginess along the jawline and a lot of loose skin of his neck. And that bothered him. And it really bothered him when we met years ago. And of course, as time went by, it got worse. And what I've loved is when we see someone who hasn't seen Jerry for a little bit, maybe even before his surgery, their mouth kind of falls open like, man, how come you're not looking any older? And he always shares that he had a facelift. And then, of course, they inspect him and they say, well, I can't even tell. So that's the thing that I think people are worried. The men I see in consultations are worried that people will be able to tell they've had a facelift. And really, as that scarring heals, it's very difficult to see.
Yeah, that's a good point. I mean, it's a little more difficult for men. I mean, Jerry was kind of out there right away. It's a little, most men don't have a lot of hair to cover some of the swelling from their cheeks. And, if you look at Jerry's, Karen, I remember when you were in the room when we took Jerry's dressing off. I think he was pretty happy right away. But, you look like a chipmunk. There's some swelling. We want to be careful. This isn't, I always tell patients, it's not a magic wand where you spin around and you're all healed. But I think attitude and just being prepared for it is a big deal. It's interesting with men. Even men coming in for Botox and other treatments, it still seems to me, maybe I'm wrong about this, but it seems that it's a bigger challenge to get men just to schedule that appointment and come in. Like they're a little bit more worried potentially about who they'll see. There are days here. I mean, you guys are seeing a lot of these injectable patients where it's like a male clinic, right? I mean, all day long it's all men. It's the weirdest thing. But I think that this is just an extension of health and wellness and looking and feeling good. So and Jerry's a great spokesperson for that. Hope, were you going to ask something? Were you going to say something?
Well, I know we've talked about how important it is to take care of your skin throughout your surgical procedure process. I was wondering, Jerry, do you use Karen's products at home, her good medical grade skincare?
Yes, I do. Some of the sunblock basically every day. Elastin, of course, it has a little tint to it, so it makes me look like I've been on the beach too. And retinol, yeah. So she's constantly, wash your face every night before you go to bed. I guess I'm a typical guy in that sense. I don't think about washing my face before I go to bed, but yeah, she, it's very nice she'll say, here, you need to start using this. And I think that's the other thing is that my skin always looks good. I mean, For the last 6 or 7 years, it's always been put that sunblock on your face before you go outside.
Great.
Hope you always got to get that little skin promotion in there, don't you? Huh? I like that. Anyway, all right. Well, listen, Jerry, thank you very much. Of course, we will see you back and have you back. And maybe we'll maybe if you're filling up your wine cellar, we'll enjoy some of that wine together too. So
that's good. Dr. Mendelsohn, I'll also offer that if there's anybody out there listening to this, as I said, whether it's a man or a wife thinking, gee, my husband, maybe we should have him come in and talk to Dr. Mendelsohn, but feel free to pass my email along to them or send in an email, and I'm very happy to take a phone call and kind of one-on-one describe the procedure and maybe take a few of the fears away that some of these businessmen may have. But it's truly worth going through it and, as I said, upping your game a little bit.
well, thank you, Jerry. All right. Well, thank you very much for everyone, and hope everybody else has a wonderful day, and we will see you back in 3 or 4 days, whatever it is. So anyway, have a great day. Thank you guys for coming in. Bye.